Welcome to the Nursing Quality Indicators demonstration. We're going to walk through how nursing quality indicators can help your students and your learners get a very clear understanding of how every decision that they make on a day-to-day basis when interacting with their patients can have a positive, a negative, or no impact at all. On the screen, you're seeing a video tutorial. And at the beginning of each section, the learner will be guided with a video tutorial so they have a clear understanding of what the task at hand is. You will see that there are 5 levels. There are 2 patients per level. 1 patient is used in the discovery phase, and the other patient is used in the application phase. Okay? With these 10 patients and these 5 levels, you should expect your learners to take approximately 4 to 6 hours to complete the entire simulation. Okay. We do have some handy tools across the top for them to use while they are going through the activity. The glossary of terms is a favorite. Just click on a letter and it'll take you to a variety of acronyms starting with that letter. There are references, of course, for all of the information that we are documenting. The help button will take them back to their video tutorial in case they missed something the first time around. The badges, as they do progress through each level, there are opportunities for badges to be earned and they will be displayed there. And then, of course, if they are ready to exit, they will click that. So let's go ahead and walk through level 1. Again, there's 2 phases, discovery and application. The discovery phase is where we're going to present your learner with situations where the patient has encountered certain situations while they are at the hospital. Okay, and what we're going to do is we're going to walk them through, if this situation happens, what should you do? And we're going to present them with 3 to 4 decision options or choices. When they review each of those choices, it's going to show them and explain to them why that is a good or a bad choice. Okay, so let's get started with the discovery phase. You can see that we have a 78-year-old retired fireman who was admitted to the med-surg unit for hip replacement, and we are going to walk through the various items that he encounters while he is there in the hospital. Okay, and again, here's another tutorial to get us on track for this discovery phase. So you are the RN, and again, we're going to be thinking very critically. We're going to break down all of these decisions into these 4 areas: the structure, the process, the outcome, and the cost. Okay, so here we have Arnold, and we are faced with decision number 1. Now, before we begin looking at the decisions, we should probably go ahead and get acclimated with our patient. So we can click on the icons on the left over here to learn a little bit more about Arnold. We can look at his EMR. Okay. We can also look at or request certain tests. We can also see, within normal limit information if we click on the information icon. There are also options for imaging, and again, we can see normal outcomes, and then you can click on the request and actually see what the results are. Okay, all right, so we'll put that away. Now, structure is identified as the measure of whether the consumer thinks the healthcare is providing things within capacity and a high quality of care. Okay, so the learner understands what we're basing our decisions on if something has an impact on structure. Process would be the measurement of whether or not we're able to maintain or improve the health of those diagnosed with a condition within the facility. Outcome, of course, is the status of the patient. It's going to be reflective of, the care that they received on the overall health status of that patient. And cost improvement, did that decision have any type of impact on the overall expenses or savings for that healthcare system? Okay, so we have Arnold, and we can see that he came in at 0700, was admitted to PACU, and we are the nurse covering for the one who's on break, and the nurse aide reports that the patient is unable to stand and move to a chair for dinner due to pain. He's asking us if he can have his dinner in bed. Okay, so you can see here are the 4 potentially obvious choices, right, that we might have available to us. So do we want to serve him dinner in bed? Do we want to transfer him despite his pain levels? Do we want to do an assessment and implement a pain management plan? Or do we just want to hang tight before we give him dinner and consult with PT? So if we click on each of these, the learner is going to discover what impacts, if any, that would have. So apparently, if we let him have dinner in bed, that's not going to have an impact on structure, right? Because we're probably making the patient happy. But process, it's not consistent with what is supposed to happen post-op, okay? Outcome, well, there's a negative outcome there because of the unmanaged pain, hasn't been addressed. And cost improvement, certainly, if we don't move him and he needs to be moved, that obviously could be cause lengthy stay at the facility, et cetera, and increase costs. So this is showing us that this is probably not the best suggestion. So let's say, well, let's just go ahead and get him up and move him to the chair and let him have dinner. Okay, well, that looks to be a negative impact on all 4 of the pillars. Okay, and again, we can read the reasons why. What if we complete an assessment and implement pain management plan? Well, that seems like a logical thing to do. It looks like it has a positive impact on structure, doesn't have an impact on process, has a positive outcome, positive impact on outcome and cost. So that one looks pretty good. Well, last choice is hold for dinner and consult PT. Well, as we scroll through here and read the rationales, we can see that that does not look like the best choice. So our best choice is to complete an assessment and implement pain management plan. So I'm going to select submit. I'm going to come back over here, and we are reminded of the prompt and the decision. And the correct decision was that. And again, here is some debrief and feedback on that. And we can continue to our second decision. Okay, and as you can see, there's a total of 10 of these. And I'm just going to maybe walk through one more of these, and then I'm going to kind of quickly click through them for the sake of time, just so you can see how this looks at the end. Okay, so now we've noticed that his second dose of post-op antibiotic was not started within the time parameters. Should we start the medication right away? Should we complete an incident report? Or should we consult the pharmacy for retiming of the meds and then complete an incident report? And I would say, based on the green plus signs, that consulting the pharmacy and retiming the meds looks like the route to go. So we'll submit that and continue on to item number 3. Okay, so you can see how we're breaking these things down into very digestible components and really letting them focus on every single decision that needs to be made. Okay. And sometimes I think, when nurses, they get busy during the day, that sometimes, they don't break things down because that maybe they don't feel like they have the time. So this is kind of allowing them to have the time to learn at a comfortable, safe pace. Okay. So Arnold now, I'm on shift, and I notice that his spirometer is sitting in the window ledge. However, they're not powered on, so we need to ask the patient if they've been using their spirometer, or just go over and turn on the device, joking that he better get huffing and puffing, or ask the patient to demonstrate use of the spirometer, educate on the use rationale, and collaborate with the RT due to patient history. Okay, and you'll notice as you go through this simulation that we are also embedding good communication skills, because we don't make light of this with the huffing and the puffing, but clearly that would not probably be an appropriate way in which to communicate with the patient to make them comfortable. Okay, so this looks to be our best route. And now we submit that and we're on to decision 4. Okay, so like I said, for the sake of time, I am going to go ahead and submit these responses so we can go to the end, and you guys can kind of read on the screen what our choices are, and go from there. And again, here's some of that empathy with the listening and the communication. And now he has swelling and redness. I'm going to pick that one. But it's through this discovery phase that they're learning why certain things are bad decisions and other things are good decisions. Okay. All right, let's see here. Go through here. And each one of these patients should, in all fairness, if you're going to read through all of these, which is, of course, the suggested path, they should take about 20 to 30 minutes, which is what leads to the 4 to 5 hours total to complete the 5 levels. Okay. All right. So let's see here. We are on number 9. We're almost there. So Arnold is at risk for readmission upon discharge. Let's see. Provide, continue, advance. Let's see here. How about we go that route? Okay. So we have now completed the discovery phase in level 1. You can see, again, a nice debrief, a summary. We see our score on everything. And now we can continue on to the application phase. And again, here's a video. Turn on the volume. Makes it engaging to listen to. Now we have a patient who has come in for a knee replacement. And I will tell you guys that when you get to levels 2 through 5, all of those remaining 8 patients are completely different. Okay, remember, this is our easy level where we're really just introducing these concepts to our learners. So you've got COPD, you've got renal failure, you've got sickle cell anemia. You just have a wide array of conditions. Okay, so now we should be taking what we just learned in the in the discovery phase and applying it here to the application phase, okay? And again, there is audio to this, but it is off for now. So our nurse comes in and we're the nurse. We say, well, how did things go before surgery this morning? And our patient says, well, it was late. They forgot my EKG. Well, were they able to do it? Well, yeah, but they had to hurry, okay? Well, that's good, but did it cause any problems? Well, they were fast and you could tell the doctor wasn't happy. I guess he was worried about getting behind or something. I hope it didn't worry you. Well, I wondered why it wasn't done with the rest of the test. Seemed like it was hectic. One nurse must have been new because she seemed like she didn't know what was to be done before a procedure like this. Okay, so that's very telling. So again, using some empathy, some good listening skills. Sorry to hear that. Surgery was okay, but a little scary when things get messed up. Not all mistakes can be fixed that easily. So here we are at our first point. An essential test was omitted from pre-op, resulting in the delay of her surgery and all sequential surgeries. A float nurse was assisting in pre-op and was overwhelmed by the patient load. So now it's our turn to, number 1, get to know our patient. So here's her EMR. Here are some tests and some imaging. And then this is the transcript, by the way, of that whole dialogue in case the learner wants to go back and review any of that. Okay. All right, so we'll put that away. So predict how this situation impacts each of the quality indicators at the bottom of the screen. So now it's our job to say, did that have a negative, a positive, or no impact at all? And you have to explain why. Okay, so remembering again that structure is the consumer's sense of whether this facility has the capacity to provide high quality care. Well, I'm going to say Antonia probably feels as though she maybe isn't getting the greatest of care because, you know, the pre-op nurse didn't know what to do. So I'm just going to type in some miscellaneous words here just so we can have something to put on our report so we can see that later. Process, again, remember, process is the measure of does the provider maintain or improve for healthy people or diagnosed conditions, are we following processes? Are we doing a good job? Well, I would say, well, in this case, probably not so good. And explaining why. Why did we not follow process? Maybe there needs to be more training, or something along those lines for nurses that are filling in, or whatever the case might be, right? So we would continue with that. Outcome, again, the impact of this could have a negative impact on the outcome, because you're potentially making your patient worry, right? So she could worry and et cetera. And obviously we would want the students to be typing more than one word answers and jargon. So we'll just put that in there for the sake of time. And cost. Certainly, it had an impact on cost if certain surgeries weren't done that day. That does impact the facility's bottom line. Okay, so we have said that we believe that because her EKG was almost missed before her surgery, that has a negative impact on our 4 components. And we say why. So we're going to submit, and right away we learn that we got green check marks. So that means we've gotten all of those correct. What it also does is it also shows the learner right away what the full correct rationale is. So even if they wrote down the exact same thing we did, we're going to make sure that they see it so they immediately get that feedback, and they further cement their learning. Okay, so that is our first situation. We have 9 to go. Okay, and I'll probably just run through these very quickly, like I have been doing, just for the sake of time. Again, if you like what you see so far in this, be reminded that we do offer 2-week faculty trials to really kind of dig into this and take a look at all the patients. So our next situation is our nurse asking, were there other delays, before the surgery? Well, yeah, was supposed to have a second dose of antibiotics, but it messed up my medicine schedule. Did they tell you why the second dose was important? Well, they said I could have a post-op infection if it wasn't given on time. Well, how did you feel about hearing that? Well, it scared me. I don't want an infection in my new knee. How do you feel now? Well, I feel okay, but I was nervous going into the surgery. Well, we'll keep an eye on the incision for any sign of infection. Okay, so breaking it down again, very minute, component here. As a result of the delay running into the EKG, the pre-op antibiotic was not timed for optimal antimicrobial coverage. Okay, so how does that have an impact? Okay, and again, we're going to go through all the same steps that we just did, and we would again type in hopefully proper, accurate words, but again, for the sake of time, I will just type in a few letters here so we can move on. Okay, and I get a chance to review them before I submit them. And it looks like, again, those did all in fact have a negative impact. Okay, all right, so I'm going to fly through these. I will tell you, this poor woman did not get up after surgery like she was supposed to. So certainly that could cause her all sorts of issues with her recovery. Certainly it could leave a negative impact on her mind as far as the processes in the hospital and the ability of the hospital to take care of her. Could have an impact negatively on cost, right? Because, down the road, but again, it's actually, this one is saying that it couldn't, yeah, okay, so we got 3 of those correct. All right, and we do have the rationales for that. All right, now we're having problems with our IV, this poor patient. But we worked through that, okay? And now, again, we're going to be going through this. Okay, so again, for the sake of time, I am literally just going to put little to nothing in here so you guys can see. I want you to be able to see the final report. So every level gives the learner a report. The faculty or the instructor can also see that same report. So you will know what information, what responses your learner gave, okay? Plus the learner will then have the ability to keep the PDF of their work, okay? And that PDF, of course, can be downloaded and it can be saved on their laptop or desktop, so they can put it either in their nursing portfolio. They could certainly put it, you know, on their computer for studying purposes for later, etc. So it's very nice to be able to have this information. Okay, and now this poor woman, if you guys are fast readers, are probably noticing that it looks as though she may be developing a case of pneumonia. Okay, all right, so we're going to do that. And you'll notice that not everything has a negative impact on all of the 4 components. Okay, so again, go through here, go through here. And when you guys, if you do ask for a trial access, again, those couple of weeks, you would be able to go through all 5 of the levels. You would be able to review all 10 of the patients that we present to you, so you could really see, you know, all the details. Also, in the faculty resources that we provide with your faculty logins, you would also have a faculty guide. And that faculty guide is actually going to give you all of the contents to all of this. So you actually don't have to go through the entire sim like I'm doing right now. If you want to just go to the faculty guide and actually view the content in written form without having to click on the buttons. Okay. All right, so we have finished the application phase of level 1, and you can see that we did score 6 out of 10 on structure, 9 out of 10 on process, 8 out of 10 on cost, and 9 out of 10 on outcome. All right, so if I want to see that report, I just simply click on the view report. And again, of course, because it is a PDF, if we hover across the top up here, we see where the download is. Okay, and you can see level 1 is now complete. Okay, you can also see exactly how much time the learners spent doing that level, and then their total scores both through the discovery and the application. And there's a very nice summary there at the bottom as well, where you can see the total time spent. Okay, all right. Well, guys, I hope you have enjoyed your time here in our Nursing Quality Indicators demonstration. Again, if you would like access to a 2-week trial, or if you have any questions, please call us, email us, or click a link on the website for free trial. Thank you so much.